Good day, everyone. My name is Kathleen Achowa, the presenter for today. Do you know that 1 out of 9 people have asthma in Australia? That accounts for over 2.5 million Australians. And globally, there are over 300 million people who have this kind of disease. So let's define what is asthma. Asthma is a medical condition. It is an obstructive airway disease that primarily affects the part of the conductive tone structures, which is the bronchial tree. So the coverage of this video presentation is about the pathogenesis of asthma. The discussion will focus on the pathogenesis causing the clinical manifestations of asthma in relation to the case study of Mr. Jackson Smith. So to begin with, let me discuss briefly the anatomy that involves when a person has an asthma attack. Asthma is mainly involved in the bronchial tree. It is the multiple branch of bronchi that provides air within the lungs. Bronchial walls consist of 3 layers. The outer layer, which is made up of connective tissue, the middle layer made up of smooth muscles that controls the airways, diameter of airways, and the innermost layer, which is an epithelial lining which contains the goblet cells and the ciliated cells. So, moreover, each terminal bronchus leads to an alveolus, a cluster of microscopic air sacs and where gas exchange occurs. Alveolus wall has a single layer of epithelial cells and elastic fibers that contracts and stretches during breathing. So these are the parts that are mainly affected in asthma disease. Now I would like to discuss the pathogenesis of asthma. The pathogenesis of asthma is a multifaceted condition from genetic to environmental factors. It is a familiar disorder where the genes influence the production of T lymphocytes, immunoglobulin E, eosinophils, and mast cells that act as a stress response receptors. So airway hyperresponsiveness and airways remodeling are also key factors of pathogenesis of asthma. Furthermore, exposure to external agents such as allergens, for example, pollen, cigarette smokes, and air pollution and other substances that triggers the allergy symptoms can cause an asthma attack. When these allergens are inhaled and triggers the airways to respond in an abnormal and exaggerated ways, it starts inducing an IgE-mediated muscle degranulation. So in this process, multiple inflammatory mediators are released, such as histamine, interleukins, and prostaglandins. These cytokines have a vasoactive effects like vasodilation and increased capillary permeability causes increased blood flow and attract inflammatory cells and chemicals to shift from the cell to interstitial tissue. The inflammatory process gives rise to increase of contraction of airway, smooth muscles, hypersecretion of mucus, thickening of airway walls, and increase the bronchial hyperresponsiveness, resulting airway obstruction. So this is generally what happens during the asthma attack. So the first clinical manifestation that I would like to point out in Mr. Smith's case is the hyperinflated lung field seen in his X-ray result. As asthma has constricted airways due to inflammation response, it is hard to move air in and out of the air sacs, especially during expiration phase. So hyperinflation happens because of early end expiration and air is trapped behind the narrowed airways, thus resulting to overinflated lung fields. In relation to narrowed airways, wheezing sounds during auscultation is also one of Mr. Smith's clinical manifestation. Wheezing sounds confirm that there is an airflow limitation caused by constricted airways as air produces vibration of nearly closed airway walls. As asthma patients like Mr. Smith develop generalized airway obstruction, thus wheezes are here widespread in the lungs. The airflow limitation is a key factor in producing wheezing sounds. It is generated by the oscillation of the bronchial walls and initiated by airflow is constricted during inspiration and expiration. So on to the next clinical manifestation. The cardinal symptom of asthma is experiencing of difficulty of breathing called dyspnea. So Mr. Smith experiencing severe dyspnea is caused by the bronchoconstriction and lung lung hyperinflation as there is an airflow limitation. When airways are narrow, the patient tends to increase effort to breathe with unsatisfied inspiration. So, inability to finish one sentence in one breath is due to severe dyspnea. As Mr. Smith experiencing severe dyspnea, which requires enormous effort to breathe, it is hard for him to talk at a normal pace. Finally, I would like to discuss the last three clinical manifestations that are also related to each other in Mr. Smith's case. He has an oxygen saturation of 94%, which is considered low, pulse rate of 130 beats per minute that concludes tachycardia, and respiratory rate of 32 beats per minute, which is tachypnea. So in asthma, alveoli are affected by overinflation and hypersecretion of mucus, which causes decreased pulmonary flow that leads to impaired gas exchange owing to the patient to manifest hypoxia. An increase of ventilatory rate, which is the respiratory and the pulse rate, happens because the body is trying to compensate from hypoxia with decreased minute ventilation due to increased airway resistance and lung hyperinflation. So those are the signs and symptoms that Mr. Smith manifests during the examination that leads to acute severe asthma diagnosis. To summarize the discussion, asthma is a condition caused by hypersensitivity and inflammation of airways triggered by different kinds of substances such as pollens and tobacco smoke and some genetic factors. So once a person has asthma, their airways are tightened due to smooth muscle contraction and thicken up and filled up with mucus that makes airways constricted. In the case of Mr. Smith, he has an acute severe asthma as he has three clinical manifestations, which categorized him as a severe asthma patient. So these are the inability to speak a few words in one breath, a low oxygen saturation of 94% and above normal ventilatory rate. So let us remember these symptoms and be aware so we can use this in our daily assessment, as asthma is one of the leading respiratory problems in Australia. So this ends my video presentation. Thank you for listening. Hope you have learned something about my topic. Have a good day.